Hi. Today we're going to talk about cervical spondylitis and cervical spondylosis, neither of which sound like any fun at all, and they probably cause you some pain or you wouldn't be here. We're going to find some exercises for you. There's a difference. The cervical spondylitis is an inflammatory arthritic-like condition. Spondylosis is the general cause, and the spondylosis is a degenerative, non-inflammatory osteoporosis. This can be caused from injury. This can be caused from herniated or dehydrated discs, stiff ligaments, maybe bone spurs. Whatever it is, whatever the cause, it hurts and you want to have something to help you with that pain. And that's what I'm doing here. What I want to tell you is that I understand. I was wrenched when I was teaching lifeguarding several years ago, and I was in absolute misery. They didn't break my neck, but they sure did a number on me, and years later I'm still suffering from it. One of the things I want to caution you about when you're doing some of those exercises is that you're going to be doing them ever so slowly, and you're going to break into them slowly by doing only one exercise until you decide and assess how that exercise is going to affect you. Do not take lightly those cautionary things that I had at the beginning about seeing your physician. I'd really rather hear that you are going to go to an actual physical therapist, or that you're going to take these exercises to your doctor and you're going to have them looked at before you ever even try them. I don't want to hear that, oh, this is a real pain in the neck, and then find out that you didn't have them approved. So where do we want to be doing these exercises? I really think that sitting down, forward on your sofa or forward on a chair or in an armless chair, but so that your back is good and straight while you're doing these. You don't want to have your spine be rounded like this and your head hanging over here and putting pressure on it. You want to be upright, you want to be comfortable this way, okay? We talk about range of motion exercises. Those are what are usually used for stretching and flexibility with this cervical problem. But we're going to use something first. We're going to be doing warm-up exercises using range of motion, because you never stretch a cold muscle. Stretch a cold muscle and you're just asking for trouble. Okay, you can see that. You can see how you could tear a muscle when it's not warmed up. Warming it up elongates the muscle, and you're going to be able to get a little bit better workout too. So we're going to do some range of motion with our shoulders, and what we're going to do first is just one shoulder up, one shoulder down. And don't do them any faster than this. One shoulder up, one shoulder down. Really think about what you're doing. Really think, oh, that shoulder's high. Think about the low shoulder. One up, one down. Then you're going to do forward and back. Bring one forward as the other one goes back. And turn with it. Keep your head looking forward, but move your shoulders by pushing your arms around. One forward, one back. Really think about what you're doing here. You really want that back, and we're not doing it fast. Now we're going to do the very same thing, except we're going to add the arms kind of moving up. Okay, so if we're doing this with the shoulders, we're going to start lifting our arms, and don't go any higher than your ears. Walk them back down. And then when you do your shoulders forward and back, just lift the elbows up a little bit. No higher than, I guess, your nose. But let yourself really turn with it, nice and comfortably. Just about that many, that's all that you're going to need. Now we're going to do shoulder rolls. We're not doing shoulder rolls like this. We're doing shoulder rolls one at a time. And that way you can really warm up and not fight your body to do that. You can see that with them together, it's really tight. And then you can just start to take the hands up, almost as though you're doing a little back stroke. That's all you need. And take one hand, put it up. Take the other hand, put it down. Just one little stretch. Do it on the other side. That's probably pretty good. Now put your hands on your knees. Drop your head and round your shoulders and let yourself go down just a little bit. Now if you have real pain, put your hand on your forehead as you come up. Sit upright totally and crack a walnut between your shoulder blades so that you're good and upright while we do the exercises. Okay, we're going to do, again, range of motion. And so that means that we have to take the head to the side. And then we're going to take the head to the other side. And remember, if this is your first time doing it, 1 is all that you're going to do. If you're doing it the next day, try 2, and work your way up to 4 at about that pace. So it would just be 1 and a little bit of a hold. Now don't go too far with it. You don't want to feel any pain. If you feel pain, back it off or stop altogether. Pretty easy exercise. I think you've got it down. But now we're going to take the exercise and you're going to dip your chin just a little. Then you're going to raise your chin just a little, come back to center, and around you go. Dip your chin a little, raise your chin a little, back to center, and here you are. Remember, just 1, build to 2, up to 4. The next exercise is do this, just like we did before. Now think about your chin and draw a quarter with your chin. Right around the quarter and back to center. Draw the quarter, back to center. Do just 1 no matter what your pain level is, unless of course there's a lot of pain, then you're not going to do it at all. You've seen people tip their head over ear to shoulder. It's a great stretch, but there's a problem here. If you're already in pain, bringing it back up hurts. So, stretch, push it up. That's 1. And over to the other side. Hold it just a little bit. Push it up. Remember, just 1, work up to 4. Okay, then the forward stretch, just like we did when we went around, you can drop your chin toward your chest. Don't go too far. Let it stretch. As soon as you feel it stretching down the spine, then you can bring your head up using the hand. And you've seen it before. You've seen them, oh, we're just going to hang our head backwards, or we're going to do a roundy round with our head and no support to the back. Worst thing in the world. The head weighs about 8 pounds. You're not going to take a weak neck and flop it backwards and have no pain with this 8-pound weight. So how are you going to do the stretch so that you can stretch down here and compress those muscles back here a little bit? As long as it doesn't hurt, take your hand, put it back, kind of underneath the bulge of your head, let yourself go back, and using your hand, bring yourself forward. I don't want to see this business happening. That's just terrible on the neck. If you're going to do a head roll, do it to the side, bring it over and in front, and omit the back unless you scrunch your shoulders just enough so that you can support it. It doesn't let you do a very big head roll in any direction doing it this way. But that scrunch or the hand behind, that's the way to go about getting something off the top shelf, getting a book, anything that you start to do. Try and get that hand up and try and make it a habit. Or the scrunch. That way you can use both hands. You can't reach up very high, but the scrunch really helps with that support. Now we're going to strengthen just a little bit, and of course, because it's the neck, you don't want to push this at all. You want to do very little pressure with this. It's not going to take much if you're already hurting. Please talk to your doctor. Hand in front and pull your chin in. Then press against the hand with your forehead by taking the head forward this way, not tipping down. So it's chin in, press against your forehead. Hold it no more than about 4 seconds. That's one. Okay? And now we're going to do the side, and it's the same thing. You don't want to do the tip. You want to kind of push this way. So push, and that's it. Other side. Push, and that's it. In the back, you can use one hand or two depending on your comfort level. You can do it this way or you can do it this way. And again, don't tip back. Pull the chin back to it. Hold. And that's the one you're really going to feel. Again, do no more than 4 once you work up to that level. Real quick too, I want to talk to you about your posture. If you are slouching down, you have this business going on, and you're working at your computer, you can see how that's going to really hurt the neck. If you're doing that, try and support it with your hand against the top of the table if you absolutely can't get away from a low thing that you're looking at. But if you really want that good posture, what you do is crack the walnut. You're sitting up straight. You can, just like me, I've got different sizes of boxes and lap baskets and the like that I put on things so that I can bring my computer up so that my neck doesn't hurt. If I have to work at my computer with my head down, I'm good for 15 minutes. But with my head up and looking forward, I'm good for a whole lot longer. So please practice these. And again, did you hear? You're really supposed to check with your doctor first.